This is Wicks, a podcast from APTA Michigan. I'm Andy Wicks. Women make up approximately 2/3 of the licensed physical therapists in the United States. Despite this, there is a paucity of women represented in the sports physical therapy realm. Women's sports has never been more popular, and yet the research on the female athlete is not as widely understood as the male athlete. I spoke with three clinicians, Doctors Katie Noble, Nancy Boyd, and Julie Wiebe, about their own journeys into the world of treating the female athlete, how they saw a need, and how they found their accelerators.
Hi, I'm Katie Noble. I'm a sports physical therapist. I'm the owner of Noble Physical Therapy and Wellness in Port Austin, Michigan. And I have a strong interest in treating the female athlete and empowering women.
Very good.
Hi, my name is Nancy Boyd, and I am the owner of Encore Wellness in Ann Arbor, Michigan, and I'm a sports and pelvic health physical therapist. And I specialize in I work with all bodies, all genders, but especially work with those who identify as women through key transition points. So going through puberty, pregnancy, and postpartum. So I do a lot of perinatal sports medicine, helping people get back to the things that they want to do, and also work with people perimenopause and menopause. I just really enjoy helping people come back to their own bodies and learn how to be embodied and learn more about themselves.
Fantastic.
Awesome. My name is Julie Wiebe, and I am a sports medicine physical therapist who specializes in pelvic, pregnancy, postpartum, menopause, the lifespan of needs around returning to movement, and also really focusing a lot on trying to understand how we can have better communication within our profession about how we discuss and understand pelvic health. That we kind of think of it as this 2-hour lecture in PT school, and then it's not really our problem anymore. But as we move into direct access across all states, if we can add it into the differential diagnosis, because the three of us are super clear on the influence it has on musculoskeletal health, performance health, quality of life, and all sorts of other health variables, because it affects fitness. It affects the participation of a lot of people in fitness. And so just trying to change that conversation inside the profession through all sorts of different means on my end. So sort of, we all have that same vision of really helping center these needs. So out there.
Fantastic. And what I've learned, so I know some fantastic therapists who specialize in pelvic health. And then we've been fortunate enough to interview a few of them. And the main takeaway that I've taken is that everyone has a pelvic floor. Everyone has a pelvic floor. Men too. And yet it is still, if you get a 2-hour lecture, holy cow, you must have had a really luxurious PT program to devote that much time to it. No, I'm kidding. It's where do you put it? Where do you put the curriculum? Anyway, but that's not what we're talking about.
For that question?
Later. Save the soapboxes for later, Julie. Save the soapboxes for later.
Or not soapbox. There's ways to do this.
What we want to talk about first, Julie, settle down, is the three of you plus a couple other people presented at the APTA Michigan annual conference last fall. I'm going to let you say the entire title because it's a long title of your presentation, but I would love to kind of hear how you got to that conversation or how you got to that point of saying, hey, we really could present on this and spread some wisdom, but then I can give some feedback about what I heard from from the audience and things like that. So how did you get there?
Yeah, we also presented with Doctors Hannah DePaul and Hannah Cook. And all of us between each other and then as a group have had these conversations about how do we support female athletes. We're hearing some of the same feedback in the clinic that I used to think and go through when I was a young athlete. And we're seeing that women have these needs that continue to go unaddressed, even generation to generation. And how do we best support girls and women? And eventually Dr. Hannah DePaul said, why don't we do a presentation at APTA and we'll take all of our unique perspectives and put them together as a look at treating women in all of our different niche areas. So that's kind of how it came together. And then I think we were all just collaborating on a Google Doc. And I personally was listening to a lot of the Tortured Poets Department at that moment. And it just really seemed to come together. So
Because the name of your presentation was what?
The Tortured Physical Therapist Department, ushering in a new era in women's sports. And yeah, so we wanted to highlight how we can better treat patients and how we can offer our stories, our personal stories of how we got to where we are, to just put it out there for other clinicians to know as well.
And particularly supporting, I'm sorry, Nancy, I'm jumping ahead of you, but just that we wanted to support future potential, like folks who are looking toward, like, how do I get into sports medicine? So how do we actually do that? What is that? What do those paths look like? And we each have very unique paths into sports medicine. And it's too bad we don't have all 5 of us to hear all the stories of how everybody got into sports medicine, because we all treat in kind of different ways. But I think that was a huge thrust too. Like, how do we offer, particularly students, because there are a lot of students at that fall conference, how do we offer them some guidance on how to move into those roles?
Well, that's a question that we all hear all the time. How did you get to where, how did you get to do what you do? And, there's never one answer, but it's nice, I think. I would think it'd be comforting, but I'm not a student asking that question. But I think it'd be comforting to know, hey, there's a lot of different ways to get there. There are definitely the students who are like, no, I want tell me the path. Where instead of being like, hey, there's 6 or 7 or more, who knows?
I think people learn a lot through story. And so we really want to bring like more seats to the table. We want more representation in sports medicine. We all had unique journeys into sports medicine. They're like, females in general are underrepresented in sports medicine. And we all had like our own unique sports journeys that led us here too. And we need people who were like super successful. We need people who got injured and burned out. We need people who are on all aspects of the gender spectrum to understand the unique needs of female bodies. So we just wanted to share our stories to bring light to the many pathways, as you were saying, and just that like all are welcome. And the more that we have, the more we're going to better serve these needs that still aren't being.
Oh, I'm going to, full disclosure, I have probably multiple times on this podcast said that I was one of, and I'm sure there are many students and many clinicians out there who was the injured jock, who that was their first exposure to PT, and then going into PT school was like, I'm going to do sports medicine, and then halfway through school was like, that's the last thing I want to do. But you guys all stuck with it. You stuck with it. I love it. And really, we all know that. Thank God, there's a wide variety of the things that we do. Like, I'm so glad that you are there working with sports medicine, because that's not what I want to do. Just like I'm sure there's people who are like, oh, you work with the brain injured population? No, thank you. We all got our thing. I don't know where I was going with that statement, but I felt like I needed to come clean that I do respect the sports medicine therapist. It is not my wheelhouse, but I'm glad that it's somebody's wheelhouse right now. So,
well, I started out wanting to do peds. Like, when I got to PT school, I thought I'd do peds. Like, never in a million years. Yeah. So you never know. Like, you never know.
You never know.
Cool.
Never rule anything out.
And public health definitely was not on my radar. I didn't even know it existed. So yeah, we all kind of find their own.
Yes.
Yeah.
So you talked a little bit about wanting to increase representation. So within kind of, I think, increased representation of, if I'm understanding correctly, women as practitioners in the sports medicine field and researchers. So talk about maybe what that has looked like in the past and what it's looking like now, and maybe what you hope to see it look like in the future.
This is where we need Hannah's stats.
Okay.
Yeah.
You pull them up. Do we have them there? Because Anna DePaul did such a nice job of really sort of laying out what the very limited amount of representation there is. But can you get those stats up, Nancy? Like, I'd have to dig. Are you have?
But yeah, let's see if we can find them. I mean, I do know that women are significantly underrepresented in sports medicine. Like, we are the minority in terms of practitioners. And then interestingly, if you look across the PT spectrum, independent of specialty, we are also paid less per dollar compared to our male counterparts. So looking to kind of get answers to that. Like all of us here are mothers, so there is time off to birth children. There are things that like set women back or do not set women up in terms of childcare and support to your careers, especially in sports medicine, where the hours are not necessarily the most alluring in some of these specialties. If it's working the sidelines or working after games and practices. And so I think that there are some unique ways to get involved in sports medicine to like fit those unique needs. I think Julie had some of that in her story as well in terms of how she even got into this field to create time and space for taking care of her own children as well. So yeah, I don't have the individual staff. I'm going to look here while someone else is chatting and see if I can bring any back to you. But those are some of the main factors, is just like underrepresentation. And then when we are represented, like why isn't the pay matching? Like there are some inequities within our profession and at large as well.
And I think one of the things too, and Katie, is that this last Olympics was the first one where we had parity among the athletes. So we had equal numbers of female and male athletes. So we're really finally at a place where we're seeing that kind of level of female participation in sports. And so, but we don't necessarily have practitioners that understand maybe the journey. And the one thing that Nancy did bring up is we were all athletes once. I'm the furthest away from my athleticism probably, but that like to understand that journey and the demands that are on that female from some of the gendered pieces of the puzzle too. And so we are at a place where we're seeing that many more female athletes, and we're celebrating Title IX, I think today. Am I crazy? Is today at least I saw something on TikTok. I don't know. It's 53 years old.
Holy cow.
Yeah. But we're still not at a place where we have an equity in terms of how many practitioners, and, most of the male coaches are still like 80% male coaches. It's still, so we have a long way to go still to create that. And that's part of why I think we wanted to support that next gen. Like, we need you.
Yeah.
We need your voices. We need your brains. We need your stories. And we need you to move into where we can support our females. And it doesn't have to be athletics, like understanding this there's actually differences in TBI and concussion between male and female. And we know
big
that,
time,
right? Yeah. And so we need folks that understand all of those differences and come at it with different kinds of questions and understanding from a female lens. So
I think if all the women in physical therapy rose up against the men, I mean, you outnumber us almost 2-1. Like, come on, it's just a numbers game. You could take over. Come on. Why haven't you done that yet? It's interesting.
You heard it here first, folks.
So I have 3 kids. I have twin boys and I have a daughter. My daughter is going into 3rd grade right now, and my boys are going into 9th grade. And my kids my boys especially have been athletes since they were, 2nd grade, maybe, whatever. And I'm used to that. And it's interesting to watch my daughter start to move into that world as well. There's a part of me that gets really excited because as a fan of sports, like women's sports, there's never been more visibility for women's sports, I feel like, than there has been in the last 2-3 years, man. I love it. I watched way more of the women's March Madness tournament than the men's, things like that. To me, it's just it's more interesting. But it's also interesting when you say things like coaching still is largely a male pursuit in general. I had an interview or an episode of the podcast, God, almost way back when we started. It was an article that was written way back in 2007, but it was a survey of first-year PT students. And it was all these, demographic information, but then it was asking about, like, what do you think is going to happen with your career? Where do you see your career going? And what was interesting about it was that the men who responded, again, these are first-year students, the men who responded compared to the women rated themselves with statistically significant margins more likely to own a business, be a manager, be a faculty member, be published. All these have a higher salary. Their predictions for all these were higher than the women that they polled as well. And it was just a very interesting, like, even from the get-go. Now, granted, this is almost 20 years ago, but still, I don't know how much has changed to say, like, why is it like that? Why is it like that when women? Now, PT isn't quite as imbalanced as a profession like nursing, but even in nursing, I had to do a little research for this, that in nursing at that time, when I was doing some numbers, it's almost a 90% female population, but yet men make up a greater percentage of management, in leadership positions, and have a higher average salary, even though they're the significant minority. So why is it that way? Why are we dumb?
You're asking the wrong people.
Yeah. Yeah.
Or what do we do
And
about it, maybe?
I think, yeah, well, I think we all have lots of ideas of what to do about it. But I think for me, I realized, like, if you had asked me as a first year PT student, I would have absolutely said, I will never own a business. I will never do anything that I'm doing now. And I came about business ownership. I came about, I'm a coach as well. I came about all those things because there wasn't the services, the visibility that I felt needed to be in my community and beyond. And so if it was going to happen, I was going to have to do it. I was going to have to be that person and create something new in order for other people, hopefully future generations, to benefit from it. So yeah, I would have absolutely said, I will never own a business. I don't want to be a manager. I want to go to work. I want to go home and be a really good clinician. And I still, of course, want to be a really good clinician. But just as you get out there and you realize, like, oh, in sports medicine, like, maybe somebody wouldn't have picked me to be on the sideline of a basketball game just at face value. Maybe somebody looked over me and didn't see my skills because I wasn't the loudest or the tallest, literally the most visible. And so it just makes you realize that in order to really change things, sometimes you have to start something new, start from the bottom and create something new in order to start to create a wave of change. And so that's how I came about business ownership and with what I'm trying to do in my community with business ownership and coaching as well. You just sometimes have to do something you thought you would never do and try to create something that doesn't exist.
Love it.
Yeah.
Julie or Nancy, any thoughts on that topic?
I would totally agree with Katie. When I went to PT school, I did not perceive myself as a business owner. And honestly, even if you had talked to me a year or two before I went on my own, I didn't see myself as a business owner. As I just found myself getting frustrated with body parts being segmented, and you had to go one place to get your shoulder treated and another place to get your pelvic floor treated, and forget about the abdomen after a surgery because we just skip over that body part. So I wanted to be a place where the whole person and the whole body were cared for, and they didn't have to get 5 different physical therapy scripts. So out of my own frustration for how care was starting to get divvied up more and more, and how insurance was dictating that more and more, and dictating the number of visits and what was considered good enough for somebody, I wanted to go to a place where people could get back to all the things that they wanted to do, and that we weren't just stopping at climbing up the stairs.
Yeah. And really, like, really, I've had a similar path in the sense that I just was dissatisfied with what I could offer in the traditional setting. But there was only the traditional setting back in the day when I started. Like, you were either an owner or a clinician. Like, there really wasn't any nuanced. And I also had no desire to be an owner. I just wanted to be, a great clinician and do right by my patients. But I stopped I really couldn't. Like, as I grew in my understanding of these needs, which for me was learning after I had my first child, like, there really was no path for me to get back to exercise, let alone any of my patients. And I was seeing them a decade after they'd had a child, and they were still presenting the way I was feeling and I was experiencing as a brand new mommy. And so, like, they had never had an opportunity to really recover. And now I was really seeing them because of that lack of recovery that had led to overuse of something else, right? Yeah. And so for me, like, I had to go backwards. Like, I had to go back in time and try to find those people, like, time machine myself back, find them before they got into trouble, right? Like, and that's not the model we have. We have a responsive, reactive model in medicine versus a more like, how do we get to the beginning? How do we get back here where we could have actually prevented a lifetime of not being able to participate in fitness the way they wanted to? Like, what would our middle age and menopause, what would that look like if we could actually get to you right after you had your baby, or my dream adolescence, like Katie, but pre-pregnancy? Like, how can we build that in. And so our model in terms of physical therapy doesn't really support necessarily the kind of care that I think probably most of us really want to deliver. We're not alone. And so I had to leave the traditional model, but there was no path. And really, that's the message for folks out there. There are no paths. Like, you just got to go out there and make your path.
It's not that there are many paths, it's that there are no paths. And
yeah, exactly. And but then you get to create yours. Like, you can build it. And so, and I wanted to be able to be home with my kids too. And so I had to kind of craft away from
it. Sounds like all of you, to some degree or another, you saw a need and you chose to fill that need, which is great. That's, necessity is the mother of invention, speaking to a bunch of mothers. It's
also a great business model. Find a gap.
Yeah.
And find a need and fill it.
Yeah. It's so interesting to hear you talk about, Nancy, how you're like, I just forget about the abdomen. You don't need that, especially after you have a kid or, God forbid you had a C-section and here's now your 10-pound baby, go lift it and walk around. The whole just the way that healthcare, and this is a tangent that could go completely, we could derail everything, but here we go. Western healthcare and how it has not only medicalized pregnancy and pre and postpartum life, or pathologized it, I should say. And then there's never been, it seems, a desire to return that person to what they used to do. So you're a runner. Great. You probably want to get back to running someday. Oh, well, you're a mom now. So let's just forget about running. That was in the past. Like, and it feels like that's such an ingrained part of the world that it isn't even something we can, we don't even think about it because it just is. And how do we, the next generation, you talked about that already, like the next group of people that's coming down the pipe, the students that I teach every day now, like, how do we get them to shake the model up to make it better? That question really tailed off at the end, but
what's good?
I think this is where, when we were preparing our tortured physical therapist presentation, we started calling these people that have helped us in our careers, or people we really look to as mentors or just visible guides for inspiration, as our accelerators. And I think that people, especially young women, can really lean into that a bit, is find people that mentor you, that you look up to, that are doing something new that inspires you, and ask them questions if you have the resources to do that, or follow them and see what they're doing and use it to inspire your own vision. So what I really thought was cool when we started developing this presentation is that we all found that some of us were each other's accelerators. And so,
that's
like,
funny.
Nancy took some of Julie's courses. And then when we were presenting this, Julie had no idea. And she was like, really? Oh my gosh. And it's like, well, of course, Julie. And like, Hannah DePaul was my CI for my very first clinical rotation, my 10-week clinical rotation in sports medicine. And she's somebody that I credit for laying a really solid foundation for me. So we often think about accelerators as people like in the past, like our ancestors almost, like, oh, way back when so-and-so did something that was remarkable, and I'll never do something that remarkable, but like I'll take a little inspiration from them. But what we really found is our accelerators are present tense, and they're our friends, they're around us, and they're people that inspire us in real time.
Yeah. Ooh, I like that.
So I would say look for your accelerators.
Oh, I like that. Good. I'm gonna steal that. No, I won't steal it. You have it, but I like that a lot. And I want to say two things about that. One, that what is your advice for students who are like, I saw this person. I saw something by this Katie Noble person. She like seems so cool. Should I reach out to her? If my student asked me that, what should I say?
You say yes. Reach out to her. Yeah. Does she have an Instagram? DM her. I talked to her in a podcast. Listen to it. Here's her email. Anybody is free to contact me in any way they can. So it just, because we all had people that we reached out to and took a chance and sent that email and put ourselves out on a limb for, in a vulnerable position. And sometimes it worked out and sometimes it didn't. But like it putting yourself out there, that's the important part. So yeah, the answer is yes, every time. Make a cold call if you have to. Like I've done that many times.
Well, yeah, and it's like, while I think it's really cool that you're like, oh, there's this really cool therapist that I follow or whatever it is. In the end, they're all just still people. They were PT students at one point. If they're a physical therapist, like if they have any shred of humanity, like they'll remember what it was like. And chances are most of them will at least be like, oh, that's so nice. Thanks for reaching out. Like, but probably will be more than happy to give you a little advice.
My experience is, and I told my students too, like folks love to help students. They love it because everybody wants to contribute to the next generation. Like I really think ultimately, and I think probably everyone, has a little, I don't know, whatever it is, they would love to help. So just for students,
there's a little ego boost in there. You can say it, Julie.
Oh no, actually that's not where I'm going.
Okay.
I think say there's sort of an educator inside all of us because it's a part of what we do.
Yes, that's true.
But no, sorry, wasn't going to ego. I was going to educator. But yeah, no, I think that people need to see that or recognize that it's just, we really are just as happy to talk to anybody. I know I am. I love it. I get high schoolers that write me because it's like career month and they want to be a PT and they found me on the internet.
Nice.
I'm like, yeah.
Just going to say most of us are more than happy to like have a coffee or a chat, and there is more than enough need to go around for everyone to own a business and care for the people that they want to care for. And so I think we're all just like, it is this pretty small community once you get into it, and we're more than happy to help like other people get involved or find the thing that's going to light them up and help them, stay in this profession too, because burnout is pretty high as well, and we're losing some really great PTs to that too.
Yeah.
And sorry,
keep going.
Can I rip off of Nancy? Is that I really think what each of us found on these crazy paths we went on, and each of us had a different path, is what we're passionate about. And so I think that the way that, you asked, like, what do we change? And I think we've sort of created the very pillared, like, you either do acute, you do, you know what I mean? Like, I know that a lot of the students were like, well, I think I want ortho, but I'm still kind of interested in acute. Like, you have to choose.
Yeah.
You know what I mean? It's like the sorting hat. You know what I mean? Step forward, and it has to look like this. But the reality when we get out there is we don't need a bunch of robots. We need folks that are passionate about something that really lights their fire. And if you really love runners, find a way to work with runners, or if you really love adolescents, like let's make that happen. If you love ladies, you know what I mean? Like you find your people, and I think that that's what we need. That's what's going to solve burnout. It's that we've created this very stale look at like how we can apply our skills, and it has to be in the traditional model. Yes. And I really think that we can offer our future students so much to use their creativity and their passions to guide them into changing our profession for the better, like to look for new ways to apply our skills, because our skills are really cool. And really it's problem solving, it's filling gaps, it's finding needs. And that's what we need, is for folks to be passionate about those particular things. So, yeah.
I love the sorting hat analogy. That's so apt. It's great. And it's funny because
for mine, silos, I do sports medicine and pelvic health, like Nancy. Like when the students are like, I don't know what to choose. I kind of like pelvic health, but and I'm like, everybody's got a pelvic floor. Everybody has these needs. And again, it does affect quality of life, movement, control across all these populations. So back to,
there is no ortho patient. There is no neuro patient. There is no pelvic floor patient. There's just patients.
It's one.
Yeah. And that's tough. It's a reality that the students face when they're these third years that just third years just graduated and they're taking their boards and blah blah blah, and it does probably feel like that to a degree, but it's hard to communicate to them about, like, yes, you maybe are choosing a setting in which to work, but it doesn't define what you do. You hopefully, if you find a good job, is a place that allows you to explore, find where your passion is, and then figure out a way to use that in their setting. Like, that's what the good companies would be like, okay, oh, you're really interested in working with runners? Cool, let's try to build a running program, or whatever it is. Like, instead of, well, sorry, all we see are, backs and shoulders, so have fun. That's what kills the spirit. So
And that also comes down to choose wisely. If you're out there getting ready to find your first job, choose wisely. There's a ton of jobs out there, y'all.
Yes. There is no path. Make your path.
Yeah. New path.
Yeah. There is.
And seek out mentors or accelerators, like Katie was saying. And I think also look outside of our profession. Like we can learn. I've learned a lot from like personal trainers, physicians, naturopaths, OBs. And so like we have a lot to learn. Business people, like totally outside of healthcare. So as you're making things your own, like mentors come in like all different forms. So I think it's not even just looking for like, who's the PT doing what I want to do, but like, where are there like gaps in what I want to learn, or where are these holes that I'm seeing for my patients, and like, how can I help solve those problems, or like even just learn where to send them to kind of fill in missing pieces of the puzzle.
I'm so glad you brought that up, Nancy, because that's a fantastic message about finding, and I think I'll say it, I only want to say it's for me. I don't want to generalize it to other people, but it's like I had to give myself permission to find mentors outside of the profession and figure out a way to pull elements of whatever they did into what I do. So again, full disclosure about how nerdy I am. I listen to a lot of podcasts about role-playing games. I love playing like D&D and stuff like that. It's totally me. And there's a couple that have players and game masters who are just such good communicators and improv performers that to listen to, even it's just to listen to how they communicate with each other and kind of, you know, if you're going to play a game like that successfully, you have to be an active listener, because it's a whole bunch of yes and if you aren't paying attention, or if you shut things down, well, the game sucks and no one wants to play. So to be a good active listener and to use that to get to the next step or whatever it is, like that's a skill that I used in clinical practice all the time, because if I'm listening actively to my patient, then I'm going to hear things, maybe pick up on things that I would have missed otherwise. And it helps me to make a better treatment session. It helps me to connect with them on a level that's maybe, one step beyond just your average run of the mill interaction. And even that little step can be a huge, suddenly they're like, oh, Andy was listening, or he was actually paying attention to me, and now I'm invested a little bit more. So, again, that's from nerdy podcasts, so you can get it anywhere. But like, good communicators, good business leaders, good, whatever it is, people that you just feel like, wow, they just seem like a good person. What are they doing that I want to do? I love it.
Yeah.
Love it.
Yeah. I think a lot about how we better communicate in our profession and just in general, but especially in our profession. And that's like a big hallmark of my treatment style is a lot of listening, a lot of almost interviewing. And my background before PT is in journalism.
Ooh.
And so I have a journalism degree. I was a writer, reporter before I went back to school to become a PT. And when I got to PT school, I was like actually pretty embarrassed that my background wasn't in a science related field. I just felt like I didn't take the kinesiology class that everybody else took and have that professor. I didn't do this. I didn't do that. And I did not tell people at first that my background is in journalism. And eventually, as I went on, I began to see it as a strength, because as we got more into the program, I realized how much my communication skills were driving my treatment style and helping me ask questions and helping me interview a patient. So the path that you choose, like, you may start somewhere and end somewhere different, and it may make sense. It may eventually make sense. So that's what happened for me. So yeah, just kind of going off to communication, like that's a big one for me, but also with the paths, like your path isn't going to be a straight line, and mine certainly wasn't.
I bet your professors picked you out of the crowd very early with like, ooh, Katie actually knows how to ask some good questions here. Like, that's not an innate skill. And
no.
Well, and the communication is so huge, because you could know the perfect path for this person to like heal. And if you can't communicate that to them or help them find a buy-in or a why as to like how they're going to keep taking care of themselves, then you've lost that. Yeah. So like the communication is just as important as I don't know, more like clinical sciencey stuff that Katie was mentioning. And I was just thinking, Katie, as you were talking, like, and you're talking about your interviewing, and it's very cool to answer those in the background, because as you're interviewing your patient, you're thinking of, right, how can we make this story have like a really great ending for them, or like a great next step.
Oh, I love that. I love that. I'm going to think of it like that now too.
That is awesome.
Yeah.
Wow. So many
Yeah.
gems in this episode. I love it.
I know. And this is what happens when like we all would get together and talk about our presentation. We just end up like coming up with like these amazing stories and experiences that I would just walk away and just feel so inspired. And yeah, I'm just so thankful for, my group of friends and this presentation, because it really helped, I think, get on paper and get out publicly like what is important to me as empowering women in PT, being a clinician, doing some trying to treat in a rural area where there isn't a sports medicine presence, and there are not always a lot of female coaches. It was just really inspiring to sit down with these women and to feel it, to actually be excelled in real time.
It was cool. And we also just got to get together, which was
I thought it had been time.
yeah, it was a good time.
Okay. We're going to get to soapboxes soon. So, Julie, you can shine there. But before we do that, I want to ask a very pie in the sky question. You can choose not to answer if you don't want to. That's fine. But I would like to hear from each of you individually. 10 years from now, what would you like to see as a reality with, I'm going to call it women's sports medicine? I'm going to leave it at that. I'm not going to make it any more specific than that. 10 years from now, what do you want to see be like? It's just a given. It's just an accepted fact of life in women's sports medicine. Doom, 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 doom.
I want to see more representation across all professions in sports medicine. I want to see more female physicians, PAs, physical therapists, athletic trainers, everybody who has a stake in treating the female athlete or in treating athletes. So more representation, especially representation that we haven't seen in like on the sidelines of the NBA. High visibility position that people will look at and be like, oh yes, this is normal to have a female trainer for a male team. This is normal, something that isn't necessarily normal now. So that's definitely something I'd like to see more visibility, more women in those positions. And also it not being like a one-off odd story, like here's the big story about the one physical therapist in the NBA. I want it to be like, oh yeah, like 50% of our staff is our female clinicians, and they're amazing, and they got this job because we didn't overlook them like we would have 10 years ago. So that's something I'd like to see, as much as the list is long.
Great.
I'd like to see that the female athletes looking for the care that they need are finding the care that they need. So I think like some of us came into this because of our own athletic journey. I ran cross country with Katie at Michigan State. I had 5 stress fractures over the course of 2 years. Nobody ever asked me about my period or how I was feeling for my sport. So when those female athletes are going through these kinds of transition, that they are able to find that person, I think a lot of us needed. So that when we get to telling these stories of like how we got into this profession, it's not because we broke our bodies 5, 10, 15 times. It's because we found someone who like really helped us through and gave us the tools that we needed, and then wanted to provide those for the next generation. So I think just like access to resources, like the information is there. We know the information now, and we're still seeing, bone stress injuries on repeat, really high incidence of relative energy deficiency in sport, eating disorders, and like they're prevalent in all genders, but are of higher incidence in females, or at least now. People are losing their periods and told that like, oh, just because you're active, that's normal. Even though we know, in this room, we know that's not the case, but it's still not like general public knowledge.
Yeah. And yes to all of that. I'm also thinking like where we've had such a surge just in the last few years on research around these needs. And so I think what I'd really love is in 10 years for us to have the body of information that we have on female athletes, or, that we really understand the intersection of all of these pieces, that we have a much more robust understanding that it's one of the things, this is not my phrase, but it's to pink it and shrink it, that we're just smaller men and that we just applied male dominated research. Like we really haven't researched females.
Yeah.
And that is, it's not my phrase, that's out there.
No,
that
I just think it's funny.
it's a great little phrase that we just pink it and shrink it, because what that will drive our clinical practice.
Yeah.
But then it would also empower the clinician, right? Like we need to, so in 10 years, if we can have better research, just a pile of research, so that we have a much more robust understanding of like the risk profile for certain things. Like how do we address, these needs in a very individualized, tailored way versus like, oh, well, because anyway, so I think that's a piece of it. But really, I would also, and this does get back into my soapbox, which I don't feel like should be considered such a soapbox, but is that we are educating really differently in 10 years around some of these topics.
Oh, man.
That in 10 years, and that'll be fed by the research until the research shows, why it's important. It will be difficult for us to change our educational models. But you asked what we could do, and I'm going to give you one story I didn't get a chance to say. I got my TDPT in 2020, and I did it for the credentials so I could start working in academia. And my textbook for differential diagnosis included a picture of all the most common scars on the abdomen. Do you know what was missing? This was look at the eyes. This is the most common scars on the abdomen. This is what is taught to PTs in 2020, and it was missing C-section scar because it was a male ortho. So if we're still not even including, and if you want to talk to somebody fantastic about that, Rebecca Seagraves is looking into really changing up our understanding of that. But C-sections are 1 million a year. They're more than gallbladder, appendix, like all these other scars. And it was missing. So it doesn't need to be like about like what we think of as these female-y things. It's like, you're an acute care therapist. You should know about the C-section scar. You should know how to educate someone how to take care of it when they go home, like all of those kinds of things. And we have literally jumped over the abdomen, jumped over what we considered this normalization. Like it's normal, you know what I mean? And so that was 2020.
Wow.
And we need to appreciate that's the level of what we're still teaching about females. And that needs to change. So it's not, I don't think that's a soapbox. I think that's a rally.
Okay, I won't take away your soapbox for that one, Julie. Everyone gets one. I won't.
It is a problem.
I'll give you that one for free. But it's just interesting. I've talked with a lot of students about wanting to get more involved in pelvic floor, which is fantastic. I'm so glad. But they've all been women. I mean, not necessarily a surprise. It's just a fact. But I'm like, as you were talking about this, like an acute care therapist, if it's a guy, you still need to be aware of what a C-section scar is, where it is, and how it affects mobility. Like, just because you don't have a uterus doesn't give you an excuse to not know these things. So, interesting. Oh, boy.
Well, who was with me? Were you with me, Katie? I can't remember who was with me, but so we just went to this female athlete conference in Boston, and there was, 1,000 people? Was it 1,000 practitioners? Probably I think there were 10 dudes. Right? Like there were some practitioners, but there were definitely some clinicians there. No, I know who was with me. It was a different PT. And I just was waiting for someone, and this guy came up and he was waiting in the same space. And I said, how does it feel to be one of the few males here? And he said, I can't believe how many people ask me that question. And he said, because I'm treating female athletes, it makes sense that I'm here. And I said, you're absolutely right. And quite frankly, this entire place should be filled with dudes. Yeah. Like it's not the female practitioner conference.
That's a good point. It's
athlete conference. Yeah. And the fact that it's like still, and that's another thing, like how do we change that conversation if we continue to see it as something separate?
Yeah.
If we see it as something that's so out of the realm of what we should care about. And I don't know, I've had male doctors, I've had male gynecologists. Like it's not that way in other areas, but for some reason, PT has been a little slowed down. Yeah.
Yeah, totally. It's a good point.
Okay. Wow. Okay. Well, now it's time for soapboxes.
I have lots of soapboxes.
Well, Julie, you need to take a break. Okay. You need to sit down. You need to take a break. Okay. I'm going to go back to Katie.
No. The answer is no.
I can remove you from this call, Julie. Okay. So we know Julie has some more soapboxes to talk about, but I want to offer an opportunity to Katie or Nancy. Are there any things that just and it can be completely unrelated to anything we've talked about so far, but just something that irks you. You're like, I want to stand on that box of soap, which is a thing, I guess, and preach to the people in the public square about why they need to listen to you about whatever. You don't have to have it. This isn't a requirement. It's an invitation.
Nancy?
I guess related to the population that I see a lot, I work with a lot of people in pregnancy and postpartum. And there's no like number of years postpartum that is too late to seek care. And like Julie was saying, we need more clinical models. We need more research to create these clinical pathways. At this conference, we were just at professional athletes were talking about how they talk to each other on the phone to figure out what the best rehab process is, because there are no guidelines out there. They're very, very fresh. There's very limited research. And so, yeah, just saying that like that path starts well before pregnancy. It's not just about your pelvic floor and core. Your full body goes through pregnancy. Your bones, your ligaments, and tendons all need to be trained to get back to the things that you want to do. And if you're finding that you're struggling with that, there's a lot of help available. So I think just like there's no timeline to that. Your timeline can be unique. And it involves a whole lot more than the pelvic floor. Talk about how the pelvic floor hasn't been talked about, but in that space, it's like all pelvic floor C-sections are, and it's like there's a whole body.
They swung too far in the other direction.
Opposite extremes. Yeah.
Okay. Very good. There is no path. Make a path.
Yeah. I guess for me, I just feel very strongly that I want adolescent female athletes to be guided through a really important transition of their life in puberty, be guided through that in a way that is healthy and empowering and keeps them in sport. Research is showing that young girls are dropping out of sport in alarming rates around the age of puberty because their questions about their bodies aren't getting answered. They might not have access to sports bras. They might not know how to exercise or participate with a period. They might not know how to access or use menstrual products. And they might not know why all of this why going through puberty is actually a good thing, and how that will play out over the next number of years, and how it helps them become a better athlete and build an adult body. And so I just want all adolescent female athletes to have resources to know this, to have people to go to. And that goes back to what Julie was saying about the research catching up. But there is a lot of current research about this that we can access and we can disseminate to digestible ways to young athletes. So I just want young female athletes to really know that their bodies are not a problem, and their changing bodies are not a problem. And it's actually a really good thing. And puberty is going to help them become a better athlete. And it's not shameful or anything to be scared of. I want them to know all the things that I didn't know and all the things I didn't have access to at their age that would have made me a better athlete, but more importantly, a much happier person, a much happier teenager. So that's the area that my soapbox and where I feel really passionately about.
Very good. All right, Julie.
And I think disseminating that information, can I
You may.
piggyback off Katie really quick? I think just disseminating that information to coaches as well, because with those body changes in female athletes, we do see that performance that's totally normal and it's temporary when supported. But that's when we see female athletes get injured or back out of their sport because they're thinking that like they did something wrong or that they're just not good enough anymore. And really, it's like if they're well supported and well fueled through that time and given the right resources, then they're going to be much stronger on the other end of that. So really normalizing like, okay, your body's going through some changes and it's going to be a little bit tricky. Like we're going to make some like mini goals in this timestamp. It might not be a PR this season, but we're going to keep you really healthy. You're going to build this strong body. And on the other side of this, that's where your best performances are.
Yeah.
Absolutely. Normalizing plateaus in performance as part of the process of puberty I have found is one of the, if not the most important topics that I discuss with adolescent female athletes, because they usually don't know about it and they think they've peaked and this is the best they're ever going to get because they're going through puberty. And it's just, that's not true and not right. And starting to give them a better sense of their bodies is so important.
That's amazing.
All right,
I
Julie.
wish you were there when I hit my plateaus when I was a teen athlete.
I know.
Right.
I know. Me too.
Yeah. No. I know. Yeah. No, I mean, I think that my own things that are important. Like, I think we really have, what we're really talking about here is a change in our model. Like, that's what we're really talking about in terms of like, what does PT really look like moving forward? Not just for females, but in general, like what does a modern intervention strategy look like? And it isn't, we have so many more talents. Like you're calling it a nerdy podcast, but really, no, but really like those skills are the ones that are therapeutic alliance building. Those are the skills that help us to understand the patient's goals, that create self-efficacy, that self-determination. Those are the pieces that we haven't always emphasized and we talk about the joints and the ligaments and the nerves and like that. And it's very capacity driven, what we offer our students and what we kind of promote into the world about what we do. And the reality is we guide development like Katie. We guide people through these other transitions like what Nancy's talking about. And I just think, really so much of what we do is help folks know how to adapt to those changes that have been brought by either the injury or pregnancy or a concussion. A lot of what we do is adapt. We teach adaptation and we find ways to tap into that resilience that we all have, but that's not really how we sell physical therapy. That's not what we say we do. You know what I mean? We build strength or we build, range of motion, but that's so limited for what we really do out there. Like what we really do on the ground is so much more than that. And I think so we need to change our self-definition a little bit. And so I think we should change the model. So anyway, that's all.
No, just a little thing.
In here, Joel, I'm out.
Someone else's problem. So, yeah, I think a big thing is that moving from PT has been a reactive model for so long, and it sounds like a lot of you are talking about making this a proactive model, which is certainly not isolated to women's sports medicine. There's I think a lot of private practice owners are realizing, hey, if I want to keep my lights on, I got to change my business model a little bit here. But that wellness, that helping, that prehab or whatever you want to call it, but helping athletes, patients recognize like, hey, you got this change coming. Let's call it puberty, whatever it is. Here's what you can expect. Here's how we can prepare you so that the impact on the other side is minimal. All that stuff. And I think that's where we can really shine. I agree.
And now we all have
helping people.
Go ahead. Sorry. Now we have direct access, man. We can go. Let's go, people.
Let's do it.
Sorry.
Yeah, and being predictive about what you see as like risk factors for people, because in the traditional model, it's like someone's in pain until they're not in pain, and then they're discharged and off on their way. And so giving them ways to really buy into the things that are them over the long term, and then like really understanding and seeing the benefit for their own body, so that that pain is gone for 3 years and then 5 years and then 10 years versus it being, or if it does pop up, they know exactly what they kind of fell off with to get that wrong versus it being like, well, I was in PT for 6 weeks, it felt a little bit better, then I didn't do anything. It's just this model of like these really quick fixes. Well, we want a long-term fix. Like, I want you to be out of pain. I want you to be feeling better and doing this thing for a really long, like longevity, promoting that over this, like you're out of pain in 3 days and now it's back and it's different weights.
And that's really head and heart changes.
Yeah.
Like it's behavior change, it's heart change, it's expectation change. It's
I don't want to see you back in my clinic again, which is counterintuitive to a lot of things, but there we go.
Yeah.
All right. I want to be respectful of everyone's time. We've been recording for almost an hour. Holy cow. And I have a feeling that we could have talked for many, many more, but thank you so much for being a part of this. I'll say to the three of you, Katie's already made it very clear that she wants people to spam her with fill her inbox with spam. If the other two of you would like your contact info shared, you can send that to me and I'll include it in the show notes. But hopefully this episode, maybe some of these people are going to be your accelerators if you're listening to this. Who knows? And if they are, send them an email if they want you to and say hi and ask them questions because they're very nice people.
Okay.
So
yeah, please do.
All right, gang. Thank you so much.
Thanks for having us.
Thank you for having us.
Doctors Katie Noble, Nancy Boyd, and Julie Wiebe are physical therapists who specialize in working with the female athlete. Their contact info can be found in the show notes, and as you heard, they would be happy to talk with you. Waves is a production of APTA Michigan. It is hosted by me, Andy Wicks, and edited by Jennifer Hood. You can find us online at www.aptami.org, on social media at APTAMI Waves, or wherever you get your podcasts. As always, thank you for listening.
And may your documentation always be done on time.